Thank you very much, Lwazi. Let me acknowledge Minister Mchunu, acknowledge the Deputy Minister, acknowledge Prof. Shup, together with the colleagues who have joined us. We've got Nicholas Crisp, Dr. Nicholas Crisp, we've got Dr. Nben Pillay, who will be helping us in terms of the issues that are coming through. I hope I've been able to acknowledge everyone. I wish to open this press briefing firstly by acknowledging the grave situation we find ourselves in as a country as we battle the third wave of the COVID-19 pandemic. I think all of us are aware where we are and the dangers that we face and what we need to do based on our experiences from the previous in terms of the first wave and the second wave. I think most importantly for me, allow me to express my deep appreciation to our frontline healthcare workers who continue to fight wave after wave for our people. I'm certain that at this point, our healthcare workers are tapping into the most profound depths of their strength, resilience, and compassion, despite being exhausted and mentally drained by a 15-month-long war. It has been a battle all these months, and I think we are encouraged as South Africans. We celebrate you as healthcare practitioners, as healthcare workers, the frontline staff that really have kept us alive, have given us hope in the most difficult times. When we listen to stories from individuals who've shared in the social media platforms everywhere, in our families, in our workplace, who continue to say good things about the healthcare workers, who gave them hope in the most difficult times. But again, we dip our banners to those that fell in the line of duty. We honor them and we recognize them. Ladies and gentlemen, it brings me comfort, therefore, to know that our healthcare workers are protected. The vast majority have been vaccinated, and we have adequate stock in terms of our PPE. And thanks to the generous donation of multilaterals organizations such as Global Fund, but also the Solidarity Fund that has helped us. It is also important to acknowledge the close working relationship between the National Treasury and our department, the Department of Health, to ensuring adequate funding for the PPEs and a sound stock visibility system, which allows not only our officials to monitor the PPE stock, but where occupational health and safety representatives and union members have also been granted access to be able to monitor this. In this regard, PPEs are managed by a collective that puts the safety of our valued healthcare workers at the top of the agenda. We know that the current wave is largely driven by the surge in Gauteng. Yesterday, the province recorded 9,501 new cases, accounting for 59% of the new cases. The next most affected province is Western Cape, at 12% of new cases on the same day. The 7-day moving average graph now clearly shows that in Gauteng, this wave has passed the first two waves, as we said in our last briefing. Therefore, we should, and also we are saying to the provinces, other provinces, that they should not have a sense of complacency, because what we are seeing in terms of the numbers is a demonstration of an upward trajectory, and it is inevitable that the wave in Gauteng will spill over into the rest of the country. It is important to remember that, as previously announced, the National Department of Health has developed a team that works together with, put together a team that works together with WHO, which is a search team that is here assisting us to manage the pandemic, and also the development of a practical guide for the provincial health departments, outlining the steps that should be followed on how to respond to COVID-19. And this was done after the second wave, understanding and taking lessons from both the first and the second wave. Just to highlight that the strategy contains, or the plan contains, 10 interventions that the provinces needs to follow or implement and look into that in terms of preparations and responses. The first area is around governance and leadership. The second area is medical supplies. Third area is port and environmental health. The fourth area, epidemiology and response. The next one, facility and readiness, in terms of making sure that the institutions such as your hospitals and all that, they are having beds and all that. Case management, where we're monitoring the numbers and how we're dealing with them. Risk communication and community engagement. This is the part that is important, because also as communities who are listening, your response in this area, because as you are engaged, you can only work and have your response in it. Occupational health and safety as well, in terms of our environment, like environments as well. Infection, prevention and control, and human resources for our health. Each intervention area and action items have been identified specifically for each level of infection. From the department, national department, we also monitor the following in terms of key parameters that relates to the pandemic. Firstly, it's around the daily infection rate as we report in terms of the infection numbers, the admission rates, monitor in terms of the hospital's admission rates, the mortality rates, the oxygen availability, and working together with suppliers to ensuring that there isn't a shortage of oxygen in the country. PPE availability, which I responded earlier on related to, medicine availability. Where there are challenges, we also alert the provinces to the impending risk and encourage them to address the matters. Yesterday, as National Department, we held a meeting with the Gauteng Department of Health, a bilateral meeting that went into the details to look at what confronts the province in terms of the pressure that they are facing with this wave, and comprehensively finding areas and dealing with the drivers of this current wave, dealing with the strategic case management and effective containment measures. I will be also meeting with the MEC on COVID-19 tomorrow, following an advisory, which they have already provided, which has been sent to me, in terms of what are the critical areas that they are raising and the interventions that we need to be able to make as national government and also the provinces. We have also asked Dr. Mmamoloko, who's here in the panel, to try and assist us in terms of the work that is being done, detailing the national and provincial implementation in terms of the response of the search on the strategies. We had hoped that we will have a representative of the province of Gauteng so that they can be able to participate in this briefing to give us from their own view and give hope in terms of the province, how they're managing the pandemic. But you would have heard the Premier yesterday had a briefing where he detailed, based following his budget in the province, where he detailed the plans and what they are doing and the advices that they've been able to receive from the advisory panel. Also yesterday, I joined Minister Mbalula and Minister Ntshavheni on compliance monitoring in Tshwane. And I think what I need to highlight is that it's important for all of us to continue to not only wearing the mask or following the necessary non-pharmaceutical interventions, but I think what is more important for us is that even when we wear the mask, we must wear the masks actually all the time in public, but also wearing them correctly. I think most of the people will have their mask in their pockets, but others will actually wear their mask but not wear their mask correctly. So this, as part of what we do monitoring, we want to urge as well South Africans to help us in monitoring each other, but alerting each other in terms of the risk that we face. On the vaccine rollout, ladies and gentlemen, I just want to highlight that part of the surge response is accelerating the vaccine rollout. I'm encouraged that we have passed the 2 million mark for the national rollout campaign, and that we have now vaccinated a total in almost around 2.5 million as of yesterday, 5 o'clock. The program for the education sector began on Wednesday, and I must congratulate the provinces together with the Department of Basic Education, together with Minister Motshekga, for vaccinating nearly around 50,000 a day for the past 2 days. At this rate, we will be able to finish the sector by within 10 days as we hoped. I do acknowledge that there are educators in the early childhood development sector and also post-schooling system who felt left out when this program started. And I assured them that work is underway with both the Department of Social Development and Department of Higher Education, Science and Innovation for their rollout plan. This sector operates differently from basic education, and it was not practically possible to include them as part of the basic education sector program. The vaccination of the education sector has pushed our daily vaccination numbers beyond the 100,000 mark, and we are really pleased about this. And with the anticipated flow of vaccine to come, we are now confident that we will be building towards the 300,000 daily mark target that the President has set for us. I must say, ladies and gentlemen, we are still worried about the demand from the 60-plus age population group, which has continued to decrease. And as a group that is most at risk, we cannot give up on netting the vast majority of this group. We understand that this manifestation is the manifestation is as a result of combination of high vaccine hesitancy in this group, difficulties in accessing the technology to register, and as well the vaccination centers that are not easily accessible as part of the feedback we have received. We are now finalizing the plans to take vaccines to the people to ensure that we find all our senior citizens and vaccinate them for their own protection and to reduce the burden on the healthcare system. And as we indicated in the last briefing, learning out of what Limpopo province have been doing, the IMC on vaccine this week approved that provincial health department must drive what we call coordinated walk-ins to cater for this category of the population where necessary so that we can be able to see them registering and vaccinating in terms of the numbers that we are targeting and meeting the targets that we're looking for. Furthermore, ladies and gentlemen, evidence has emerged that the vaccination reduces transmission. On 23rd June 2021, the New England Journal of Medicines issued a highly anticipated publication showing significant reduction in transmission in households where there were vaccinated household members compared to households where no one was vaccinated. It even showed that the benefit was seen even if the household members only had 1 out of 2 vaccines. Professor Perushuk, chair of the Ministerial Advisory Committee on Vaccine, is here to explain these findings further and give us the background in terms of science. And also, what is important for us, ladies and gentlemen, to highlight this is because, for us to highlight this is very critical because when you vaccinate, it tells us that it reduces the chances of passing the virus to your loved ones and that you are close to. And I hope this study, as is explained later, would motivate, especially as senior citizens, but those who have had doubts about this vaccine rollout, to really take the opportunity and actually get vaccinated. I'm pleased also to announce that the IMC on vaccine approved that from the 1st of July 2021, we will open registrations for all citizens which are between the ages of 50 years and above. And we will also schedule those vaccinations to begin on the 15th of July. I encourage all the citizens to register and get their vaccine. If you have a friend, a family member, a neighbor, or a loved one who is at 60 years and above, especially as senior citizens who are battling to get move around in terms of mobility, please bring them along in terms of your vaccination centers so that you can help them. And we are hoping that in the families, this will encourage all of us to take our parents, our grandparents, our loved ones as we go to the vaccination sites in terms of those categories that are open. Ladies and gentlemen, it is important as well to explain in terms of the supply side of the vaccine that so far Pfizer has delivered nearly 4.5 million doses as promised in Q2. They have also committed just over 15.5 million doses in Q3, of which we are expecting nearly 2.1 million doses in July. Johnson & Johnson have so far delivered 500,000 early access doses used for Sisonke, 300 market doses last week, and 1.2 million doses landed last night in the afternoon, ladies and gentlemen. These doses all need to be used by 11 of August, And I think we are on track in terms of working to ensure that we utilize these doses, but we are waiting confirmation for delivery of 500 doses. And this then will make up 2 million to replace those that were affected in terms of the contamination that we announced last time. With this flow of vaccine, we will be able to press ahead with the vaccination of frontline workers, sector by sector. And I do want to confirm that we will then move on to workplace vaccination, both formal and informal sectors like the taxi industry. We will take guidance from the IMC on COVID-19, together with the MEC, on which of the sectors to prioritize, and moving along until all work-based vaccination are completed. So in summary, we are running 3 parallel processes in phase 2 as per our overall strategy. The first process is the general population registration and vaccination. The second one is priority services sector vaccination and workplace vaccination in key economic sectors. And Dr. Nicholas Cripps will also come in later and provide final details on how these programs will be run. Before I close, I just want to touch on 2 concerns which members of the public have raised, and also indicate that on the issues of Sisonke trials, as Professor Gray outlined in the last press briefing, although the study results have not yet been concluded, preliminary results show clear evidence of reduced, moderate to severe illnesses and death in the vaccinated cohort, which in this case was healthcare workers. There is clear evidence that vaccine work. So far, there are no deaths recorded related to the vaccine itself. And I think this was asked during the week, even when I did interviews. There were a few vaccine-induced thrombotic events, which were all very well detected and managed by our expert clinicians. Overall, this study provides confidence that the vaccine confers high levels of protection to those who have been inoculated with it. And just, I hope it does give clarity in the issues that have been raised previously. The second concern I want to touch on is that of Pfizer and reports of heart inflammation in young men. These events are rare, and Pfizer has decided to include this as a warning in the product label. I've been reassured by our experts that the vast majority, if not all cases that have been reported, were mild with short hospital stays, and that there have been no reports in South Africa of such cases. We will, of course, watch the space closely when we vaccinate large numbers of the general population in those younger age groups. Pfizer is still considered safe and effective for all population groups above the age of 12 years. Professor Shoup will also touch on this later when he speaks. Lastly, I wish to address the issue of COVAX and our position as a country in response to the recent developments that were announced. We believe that COVAX is still a very useful facility for low and middle income countries. For South Africa, we'll continue to ensure that we get the best out of COVAX. However, we have adopted as well a diversified approach to procuring vaccine so that we do not put our eggs in one basket, as we have been falsely accused. As co-chairs of the ACT Accelerate, we continue to support the efforts of COVAX in securing vaccines for the less fortunate, particularly on the continent, and we therefore wish to ease any anxiety surrounding the dynamic mechanism of COVAX and reassure the nation that we remain in control of vaccine fortunes as a sovereign nation. Last night, the interactive dashboard for vaccines went live, and Ms. Melanie Volmarans will do a short demonstration during this session as part of showcasing what the dashboard can do. And this is the first iteration of the interactive dashboard, and will continue to be improved as we receive feedback from users. Now, finally, this reminds me to really request that South African residents please assist us. We are begging you, we are pleading with you. We can only do so much as government in terms of the fight against the pandemic. We request you to assist us in really building a capable state and also a nation that is healthy, that is able to contribute meaningfully to its development. We can only do this when you help us in this fight of this pandemic. Help us as government, work with us together with the healthcare workers to be able to win this battle. We can only defeat this pandemic as we work together. Ladies and gentlemen, I welcome now Minister Mchunu, who is going to take us through and deliver his remarks in terms of what we are doing in preparation for vaccination rollout in the public service. Thank you very much.
Thank you very much, colleague, Acting Minister of Health in the Republic of South Africa. I think you have acting minister has covered quite a large ground on the state of affairs in relation to vaccination in the country. I will just make a few remarks relating directly to public service. I just want to start by acknowledging the Public Service Day by the United Nations, that is the 23rd of June every year, which serves to acknowledge the contribution and the role of public service and public servants in society on a country-by-country basis, but on a world stage. And also acknowledge the AU, acknowledge their own acknowledgement of public service and public servants in our own continent in Africa. We've just emerged from a 3-day conference wherein the focus was again on the role of public service and public servants throughout the continent and the world, but also on a country-by-country basis. Indeed, both the world and the continent, and in this case, ourselves, in our own country, South Africa, we acknowledge the role played by public servants and the whole of public service, particularly in periods of disaster and hopelessness, and in this instance, during these trying times of COVID in the Republic of South Africa in particular. When this disease attacked us, we never thought that it would be so long, and we would even by 2021 June be under the attack as is happening, as the acting minister has outlined, particularly in relation with certain provinces that are a bigger threat than others, especially in Gauteng. We got an impression that it would come and then go like all other diseases, and let alone pandemics, which we had never experienced in our lives at this level, countrywide and globally. We therefore want to acknowledge that public service has played a critical role in assuring that public services in the country continue, right from national, from provinces, and from local spheres of government. In particular, our acknowledgement goes to health workers, all of them in the health sector. We acknowledge the role that they've had to play, bringing hope to our people throughout the Republic, but also ensuring that they could still put a smile in the face of adversity the kind that our people have had to face all over. And indeed, we have been getting briefings from Department of Health on a regular basis, and it's clear that a lot of work has been done in the process. We also go on to acknowledge educators in the education sector for the role they've played, ensuring that under these trying circumstances, education continued as a service to young people throughout the Republic. We also have to extend our sincere thanks to policing services who have kept safety measures on course during these trying times. And of course, Home Affairs workers. And I'm just talking about this four in particular, but overall, all public servants in their various stations in the Republic who acknowledge their role very much. We are now in the age of vaccinations, as the acting minister has indicated. She has indicated the figures close to 50,000 of educators alone. We would have on our own as government, but also particularly as public service, together with ministers that serve the public in these core public services, we would have loved that the rollout would have happened much earlier, considering that they are in the cold face of the pandemic, interacting with a large part, a larger sections of the populace in the Republic. Nevertheless, there were delays, and the nation has been briefed from time to time on what was being done to ensure that we have vaccines and then work on rollouts. We are happy finally that vaccine J&J has finally arrived, and it's now being rolled out throughout the Republic for teachers. We would want to plead with those who are responsible, the Department of Health, to make sure that we don't have any hitch, we just run smoothly, so that we extend the rollout to other sections in the public service and cover everybody, including not just educators alone, not just those who work in the health sector alone, but everybody, literally everybody, and we're sure we're on course in that regard. We do have to acknowledge as well a role played by public servants in the other spheres of government and the other arms of the state. They too count as public servants, even outside the Public Service Act. They work for the public, and we acknowledge the work, magistrates, judges, and all of those people, but also people who work in parliaments and legislatures. They've done a good job making sure that government business continues unhampered. Of course, we need to acknowledge in the public sphere the role GEMS has played. We've had meetings with them, and we have received briefings, thorough briefings on their preparedness to work with government departments to ensure the rollout of vaccinations. They've identified several sites, and they have had a number of meetings with provinces who are in provincial premiers, or premiers have had interactions with them, and departments of health in various provinces. And they've worked together in identifying various sites in each of the provinces, and they've given them plans, specific plans relating to how they will play their role in vaccinating. Of course, GEMS it caters for more than their direct members, the relatives of direct members, and all of whom stand to benefit from what GEMS is doing, currently working with the Department of Health closely, as they've had interactions, and they're always on briefings together. So we acknowledge their role, and we hope that all is going to go well. We need to also acknowledge the work of the private sector, those that have made a contribution in the rollout of the vaccines, and we're hoping that after having experienced glitches of different kinds in the availability of vaccines at different periods, we are now on course to run the rollout without any problems. We are hoping that everybody acknowledges that the myth of that has been spread about vaccines has by and large subsided, and it's clear now that we all as a nation are convinced that this is the only decisive step that we can take against the pandemic, against the virus itself, that we vaccinate, that in the meantime, we keep our masks tight on our mouths and noses, and that we move on also with the cleaning of our hands on a regular basis, but most particularly we ensure distancing, which all over the world is are the matters that are put to the public as a reminder that these are the best strategies to fight the disease. And at this stage, thank you very much, Minister. Thank you very much for the opportunity to all that are involved here. Thank you.
Thank you very much, Honourable Minister, for those words. I would now like to invite Dr. Anban Pillay, as the Minister outlined previously, to just take us through the surge response, and to also just say to members of the media that the WhatsApp group for Emelo Minister of Health is open, so you may send your questions, and you may also send your questions to the chat box as well, or to the Q&A section. Thank you very much, Dr. Pillay.
Thank you, Dr. Manzi. Good morning, Ministers Kubayi and Mkunu, Deputy Minister Pashla, DG, Professor Shub, and Prof. Mulisana, and colleagues. I'm going to take you through the epidemiological trends and plans of action to mitigate against the current surge that we have in the country. So I think we all recognize the spread of infection, but I thought this slide was important in that it highlights the spread from week 22, and we're currently in week 24. And you can see the red areas in the graph, largely in the inland provinces, spreading across the country to mainly the inland provinces, but now moving into the Western Cape. Although the coastal provinces are largely spared, but I think this is a matter of time, as Minister Kubayi was saying. In the Gauteng province, I think it's very clear that many of the districts are very much in the red. So almost the entire province is at high levels of infection and transmission. And so it's really important that we implement the non-pharmaceutical interventions as we move around if we have to. I think the percentage testing positive across the country, comparing them on a week-by-week basis, you can see that Gauteng has had the greatest increase, aligned very much to the previous slide I showed you. But you see the Northwest is also showing significant increases on a week-on-week basis, as well as in Mpumalanga and Limpopo. The other provinces as well are showing increases, Western Cape as well, and KZN, although much lower levels, but certainly increases. The only province at this stage that seems to be fairly flat is the Northern Cape. We also, from the epidemiological consortium, dealing with modeling have done forecasts on the number of new cases that we can anticipate in the next couple of weeks, and they continuously do this on a weekly basis. And their latest report provides us with a sense about what we can expect. The picture not very good in that they anticipate that across all of the 9 provinces, we can expect increases, some variable in terms of the extent, but quite large increases in some provinces like the Western Cape are predicted, Northwest as well, and the Eastern Cape. But the only province at this stage that they're predicting fairly flat levels are in the Free State, where it seems that the spread may be stabilizing. This forecast obviously then places pressure on the hospital beds across the country. And we know that in Gauteng, it's very much in the red zone. And you can see on the top right-hand side, the graph relating to Gauteng, where the pressure on the beds is very significant. In addition to Gauteng, the Northwest and the Northern Cape are also having huge pressure on the beds at this stage. While the other provinces don't have the similar levels of pressure, I think it's a matter of time as the cases increase that this will happen. So we really need to make sure we implement the non-pharmaceutical interventions to prevent these admissions of infections from occurring, and consequently admissions into hospital when the facilities are under pressure. So I think just in summary, to quickly reflect on where we are currently, we can see that nationally the numbers have increased on a week-on-week basis. This is driven largely by what's happening in Gauteng, which makes up about 2/3 of the new cases in the past week. We've seen decreases in the Northern Cape and the Free State, and we hope that this continues because they've had sustained transmission for a while now. The percentage testing positive has continued to increase, currently sitting at around 24%, meaning 1 in 4 people that are being tested are positive, when previously we had about 1 in 20 at one stage. So significant increases there. We've entered the 3rd wave nationally, and a number of provinces are within the 3rd wave across the country. We've also had increased hospitalization across 6 of the provinces in the country, and increased deaths in 4 of those provinces. Coming now to our response to mitigate this. After the 2nd wave, we had developed a plan to mitigate against the COVID-19 resurgence, to anticipate the 3rd wave and prepare the health facilities for this. We've done this and prepared a plan which identifies the key indicators to track resurgence, and secondly, to establish thresholds and metrics that will alert us in any particular geographic area to the resurgence. And the map that I showed you earlier is aligned to these matrices. We also provide guidance to provinces on the actions that need to be taken in order to respond to resurgence in a particular area. The minister has gone through this, but let me highlight just a few of the areas. There are 10 areas that we deal with here in terms of the toolkit and our advisories to provinces as to what needs to happen. Medical supplies are critical, both PPE as well as medicines, in order to respond to cases that come into hospital. Also, the issues relating to port health and environmental health, and making sure that our borders are secure in terms of testing and screening. The epidemiological response around monitoring the cases, laboratory turnaround times, information systems to share that information and make sure we're able to react. And very critical is our contact tracing and community screening, so that we can identify outbreaks and close those outbreaks down as soon as possible. Facility readiness as well as quarantine and isolation become as important, and EMS needs to be activated in order to respond to critical cases. The workplace and making sure that occupational health and safety is adhered to, so there's no spread in the workplace where that may happen. And as important, and human resources for health here become critical to make sure we have as many hands on deck to be able to respond in our hospitals and clinics. So just to take you through some of the indices very quickly, in terms of the percentage of beds occupied by COVID-19 patients across the country, we monitored this on a week-on-week basis, and you can see Gauteng, Northwest, and the Northern Cape coming under the greatest pressure. The Western Cape is also increasing. The other provinces, if the cases are not brought under control, will also show similar levels of increase. We also monitored the percentage of non-COVID beds that have been occupied. And here again, the picture is no different from the previous. Gauteng, Northwest, the Northern Cape, and then the Western Cape showing increases over the past couple of weeks. The ICU beds as well, we monitored those, and you can see the Northern Cape had taken a lot of pressure around ICU beds, given that they've had a sustained level of transmission for quite a while. But certainly Gauteng is showing high increases in the ICU beds. And as you know, this is an area where we don't have lots of beds because you require specialized staff and equipment to be able to respond to ICU type cases. On the oxygen side, this is a picture around the oxygen supply and volumes. During the December-January period, we had huge increases in oxygen consumption, as you can see on the graph. But certainly we're seeing increases in the oxygen consumption. We do have adequate quantities of bulk oxygen available. The suppliers of oxygen are aware of the increases in cases and are ready to respond to be able to supply these oxygen supplies. In addition to that, we also have oxygen cylinders, and you can see significant increases as well in the supply of oxygen cylinders. We also monitored these. We need to turn these around, so when oxygen cylinders are empty, they go back to the site to be filled and sent back. And so this becomes an important area to monitor as well. In terms of medicine availability, the minister mentioned this earlier, we use the stock visibility system, and you can see we monitor stock across the country. We use over 90% across facilities as green, and between 80 to 90 as orange, and then red below 80%. You can see there's two provinces that are falling below between 70 and 80%. They need to increase their stock levels to make sure that as the numbers increase in those provinces, that they have adequate supplies of medicines to be able to respond. In addition, PPE, the minister mentioned this as well. We have all of the PPE that we would need monitored across the country. Generally, there is very good availability across all of the provinces, just the Northwest here, that needs to increase some of its PPE levels in order to be able to respond to this. But we monitor this on a weekly basis, try and support provinces to make sure that they get adequate stock in anticipation of an increase in cases. Thank you, Dr. Manzi. I will stop there.
Thank you very much, Dr. Pillay, for detailing the surge response for us. I'd now like to invite Dr. Nicholas Crisp to take us forward in terms of the details of the rollout, vaccine rollout strategy. Thank you very much, Dr. Crisp.
Thank you very much, Dr. Manzi. Good day, ministers, Deputy Minister, DG, colleagues. So what I'd like to really just explain is that we have three major parallel streams for the vaccine rollout. And the minister has alluded to these in her opening speech, but just to try and provide a little bit more detail to each one of them. Those three streams include the general population stream, the essential workers, and occupational health or workplace services. The objective of all of these streams and of the vaccination program is twofold. One, to prevent severe illness and to therefore try and decongest patients who are going into hospital. And the second one is to achieve herd immunity so that in time we have enough people in the community vaccinated and immune so that we don't have continued spread of the virus. For the general population, the policy from the beginning has been to target age cohorts, and the first age cohort was the 60+ age group and our oldest person we vaccinated is 119, according to her ID document. So a lot of older people have already been vaccinated in this program, but what we found is that only about 50% of the population in the 60+ target group have actually registered, and just over half of those have been reached so far with vaccinations. That program will continue no matter what happens. And as the Minister has just announced, we are going to open a further age category of 50 pluses, because in some parts of the country, the number of people 60 plus has already been fully vaccinated, whereas in others, we are still playing a bit of catch up. So the program has been running in the general community program for 6 weeks now. Today is the end of the 6 weeks. During that time, we have vaccinated 2 million people with the first dose Pfizer. And in the last 2 days, 100,000, just over 100,000 people with Johnson & Johnson vaccine, which, as you heard, arrived on Thursday last week. What's been interesting to monitor is that the registration of people on the EVDS system has been by far best in rural areas, not in urban areas. And very dramatically best in Limpopo, where over 75% of the population over 60 has registered on the EVDS system, whereas in urban areas, we are still battling with some areas below 35% registration. This is a bit counterintuitive, because we would have expected that populations who have greater access to digital technology and bandwidth would have registered more easily. And we would have also thought that, since we know that there's greater English literacy in the urban areas, that there would have been greater registration in those areas. This has not been the case. So nonetheless, we are trying to understand why that has happened. And we are busy at the moment loading 5 additional languages to try and see if it's a language barrier that is making it difficult for people to register. There are also, as the Minister indicated, registrations taking place at sites, and in urban areas, there's a particular drive to increase those registrations amongst this population. There's also been assistance from the Department of Social Development and the Social Securities Agency that on pension days, together with a number of private companies, to assist the elderly to register and be vaccinated. And we're going to step up that program now with the pension payments in the coming month. So the average vaccination has got up to about 85,000 per day by the beginning of this week. And that will now increase, because we now have a lot of vaccine that's arrived in the last couple of days, and we no longer have a resource-constrained environment. The methods of reaching the population over the age of 60 have been twofold, and the third one being introduced now. The first one is using our normal primary healthcare system, using clinics and other vaccination facilities in the private sector, such as pharmacies and some of the private hospitals. There's also been a lot of emphasis on what we call congregate settings, where the staff of these facilities have been going to old age homes and vaccinating people in the old age homes. And there have been a limited number of outreaches to individuals who are bedbound at home, but that is quite a difficult program to sustain under the circumstances. Where we are moving to in the next couple of weeks or within the next month is towards a number of mass vaccination sites in the metropolitan areas, and there's planning going on for how to roll those out at the moment. So as the Minister announced, from the 1st of July, the EVDS system will start accepting registrations for people over the age of 50. It will continue to accept over 60s as well, of course. And as more age cohorts are opened in future, none of the previous cohorts are closed, they remain open. The target population, or the total number of people, according to our Stats SA data in this age category of 50 to 59, is 4.8 million people. And we will be glad if we are able to reach 65% of that population, which means a target of 33 million people in that age category. The second big group, and as the Minister of Public Service and Administration has explained as well, is to reach essential workers. This started with the health workers, which would be an obvious place to start, since we want to protect the health workers who are in the front line of caring for the rest of us if we get ill. And that includes both professional health workers and the non-professionals who support the health workers. We did have some challenges in the beginning where the portal that was provided for health workers to continue to register was abused, and it became an open registration portal for the general public. So unfortunately, we had to close that and have opened a separate portal, which is now available to any registered health professional and to groups of non-professionals, as we are able to load them with a verification program so that we can confirm that they are indeed healthcare workers. That portal will remain open and will be available so we can continue to register healthcare workers. As everybody knows by now, the basic education sector has commenced with vaccination, and I'd like to, on behalf of our team, to thank the Basic Education Department for working so well with us. We're aware of a number of glitches in getting going over the last 2 days, but generally it has gone remarkably well, and the uptake by the education authorities and staff has been fantastic. Since the remaining 1.2 million short expiry doses arrived last night, as the Minister announced, we will get that cleared now over the next few days, and by early next week, we will now definitely not have a vaccine-constrained environment for the remainder of that program. It also means that we are able to start to introduce Johnson & Johnson vaccine into the general public program, which was not possible before because we had no pipeline to guarantee Johnson & Johnson vaccine going forward. The other sectors within the essential worker categories that are in advanced stages of planning, and that's just been mentioned, is the police, correctional services, defense, and justice. And some work already on customs and excise, which includes various government departments who work at border posts, and of course the staff of the Social Security Agency. All of those are, as the Minister of Public Service and Administration has explained, because they are public servants, are being managed by a program coordinated by DPSA with ourselves, with the services of GEMS and a number of service providers. And as each one of those programs is ready, they will start to roll out as well. We hope to get going with the first one during the first week of July. The third strategy is to address workplaces so that we can keep the economy rolling. And there are a number of major businesses where it's extremely difficult for workers to protect themselves with social distancing and to remain safe in the workplace. There's a very long list of potential workplaces where the economies of scale are good, and it's easy for them to provide vaccination programs because they already have occupational health services. So we are going to capitalize on those workplaces, particularly in the mines, some large manufacturing plants, obviously transport, with the taxi industry being primary for us, and also in tertiary education settings. So to do this, we will need to increase the number of sites, which is also now possible for us to plan because there are more vaccines in our stock in the last week. And both public and private sectors are gearing up rapidly. We have meetings twice a week with our key private sector players, and we are working together to work out which of the private sector sites can be brought online more rapidly and in which areas. And the minute that happens and there are more sites available, it means vaccination is more accessible to everybody. As I've mentioned, we have major partners from the Department of Health with the Department of Public Service and Administration, but also with the line departments such as correctional services, police, and the others that I've mentioned. One of the strategies which was not part of the 60+ strategy is to increase the number of uninsured people that we channel to private sector sites. In the beginning, we were sending the uninsured population to the public sector sites, but the private sector sites rapidly satisfied the demand that was coming from insured population, and they have capabilities. So we are very grateful that we are able to now start diverting larger numbers of uninsured population to those sites for vaccination. So in terms of the vaccination pipeline, it's been an extremely difficult start to the program because of the challenges we had with Johnson & Johnson, and also because the numbers of vaccines that were coming into the Pfizer pipeline were relatively limited. But as I've indicated in the last week, both of these has opened up. The minister referred to the COVAX facility and those vaccines that are coming, and the other Pfizer vaccines which have arrived recently, plus the 300,000 doses of Johnson & Johnson, which came last week, and the 1.2 million that arrived last night. Once they land, vaccines go through a clearance process and have to be examined. The cold chain data is examined, plus some of the samples of those batches that arrive by laboratories at the National Control Laboratory. And it's only after that that they get released, and that SAHPRA authorizes that the labeling is sufficient and correct according to what is required. And remember, we have these vaccines for emergency use, so the way in which they are accounted for is a little more stringent than one might normally do with any other medical product. Nonetheless, it does take a few days for clearance before they actually enter the pipeline. And we try to keep 7 days of vaccine in the pipeline so that if there's ever a problem with deliveries or delayed flights or any other logistics hassles that happen, that we are still able to maintain that pipeline and never have to turn it off. We do have a stock visibility system, the same one that Dr. Pillay showed a moment ago, where we monitor the vaccines and the critical stocks, particularly in the public sector, the critical stocks. And all vaccine sites are reporting every day on what is remaining and what has been used, so that we know where the vaccines are in that pipeline. So right now, as of this week, both the Pfizer pipeline is very stable until the end of July, and we know exactly what vaccines to expect for the next 5 to 6 weeks. The Johnson & Johnson pipeline is not yet confirmed. It's just these 1.5 million doses that we've received at the moment. We do not have a delivery schedule for the remainder. The 500,000 doses to make up the 2 million we were supposed to have received when the problems were identified in the US have hopefully will be arriving in the next week to 2 weeks, but we don't have a delivery date for that yet. And we are still discussing with Johnson & Johnson the delivery pipeline for the weeks ahead. Nonetheless, we believe that has been restored and that their manufacturing is now back online. Once we have clarity on those deliveries, we will communicate in future press releases. So what we are doing at the moment between all of us in the public and the private sector, including the GEMS that the minister spoke about, is to increase the number of sites. And it's also making it possible for us to do some outreach, and particularly into rural areas, but also into some urban township areas. The target we've been able to sustain at the moment up to the beginning of this week was in the order of 85,000 vaccinations being done per workday. That now we are able to do, and we have done 100,000, just over 100,000 a day for the last 2 days. Our target for next week is to get up to 150,000 a day, and by mid-July, 200,000 a day, with the target by the end of July being able to have enough resources in the field to do 250,000 vaccinations a day. The president has asked us to chase a target of 300,000 a day, and I think all of us in the vaccination response program are going to work hard to try and get to that point. So at the moment, and I'll conclude with these comments, is that we have 3.75 million registrations of 60 pluses, and there's 2.5 million who have been vaccinated. That means that the queue for the elderly people is still 1 million long. And that is partly a challenge because there are not sites in all the areas where these people reside, and it's very hard to get to them until we open more sites. So clearly now that we are able to open a larger number of sites in a better geographical spread, we should be able to quickly reach the remaining people who we haven't been able to reach, while at the same time sustaining the current sites to accommodate the 50 pluses who are being brought into the vaccination schedule. So the good news is we know for now we are not in a vaccine constrained environment anymore. The plans are rolling out quite quickly to increase the number of sites, And the number of activities that are taking place in all three of these streams is now rapidly coming to fruition. So I foresee that we'll be able to make a much better gains on our targets in the weeks ahead. Thank you very much.
Thank you very much, Dr. Nicholas Crisp, for that reassurance. And also from everything that you've said, I think it's important to say that everything that we do at the Department of Health is evidence-based. We do our research, we don't make assumptions, and we intervene on the evidence that is actually before us from sound research practice. I'd now like to invite Professor Barry Shu. And Professor Shub, if we could just, we are kind of running out of, not running out of time, but running a bit over. So if we could just really hone in on that New England Journal of Medicine finding, and also the issues around the myocarditis in young men with Pfizer. Thank you so much, Professor. It's your floor now.
Thank you. Thank you very much, Dr. Manzi. Honorable ministers, Honorable Deputy Minister, DG, all protocols observed. I'll just go quite quickly then through what the acting minister touched on earlier, and it's quite a significant, interesting research finding which has been reported very recently in the very prestigious New England Journal of Medicine. They actually did a very interesting study in England. It was piloted by the Public Health England, which is the public health body in the UK. They looked at their registry and they looked at those individuals that had been infected and those individuals that had been vaccinated, and they matched the two up. And they looked at clusters of households, and they kind of matched up where there would be a patient who had been vaccinated, the vast majority, over 90%, with only one dose of the vaccine. And they looked at the rate of transmission of the virus from a vaccinated individual who'd been infected to the household contacts. I'll just summarize it in the interest of time. When we go, and generally the household transmission rate is anything between about 16 to 18%. Obviously, there are wide intervals, anything from about 4 to 40%, but generally between 16 and 18%. What they found in this study is that the likelihood of transmission from a vaccinated person that had been infected to the contacts inside the house was reduced by about 40 to 50%. Now, that's actually quite significant, and it's good and it's encouraging news, because really, if we look at what vaccine or vaccination hopes to achieve, it really looks at two things. It wants to achieve personal protection, clearly, and there's a lot of data to kind of support that. First of all, the risk of infection is quite markedly reduced, and even those individuals that do get infected after being vaccinated, they usually have a very much milder disease. But importantly, we also want to look at the ongoing transmission. In other words, people that are vaccinated who may get infected, do they transmit the virus? Now, clearly there is some transmission, but I think what this study does is it amplifies a lot of other previous studies which have shown that people that are vaccinated, even they do get infected, the amount of virus that they excrete is quite dramatically reduced. There is some transmission, and this is why we do advise people that have been vaccinated they still have to obey all the precautions. But obviously, once we get, as Dr. Chris mentioned earlier, a certain percentage of individuals that are vaccinated, we will stop the transmission, or we'll certainly reduce it to a point where it becomes not a great epidemic. So I think this is an important contributory finding to that vaccination does reduce onward transmission of the virus very significantly. Let me also go quickly on to the other topic, and that's the issue of myocarditis. It has received quite a bit of press coverage. There are two countries which have really kind of studied this quite extensively. The United States, which has up to now immunized close on 180 million doses of the mainly of Pfizer and to some extent Moderna, which is very similar vaccine in that country, to a lesser extent Johnson & Johnson. And they've got what's called a vaccine safety data link, where they can look at any adverse events, any potential side effects of the vaccine. And specifically looking at myocarditis after the Pfizer vaccine, of the 180 million doses, they've so far picked up 600 reports of myocarditis. What myocarditis is, it's an inflammation of the heart muscle. And you pick it up, there's chest pain or shortness of breath or sensation of fluttering. And of that 600, 309 were hospitalized, and 295 of the 309 were discharged soon afterwards. So the bottom line, the vast majority, almost all, were in fact mild disease, mild myocarditis. Now, the interest, that would translate to about 12.6 cases per million doses. So you can see it's extremely rare, but it had been picked up. Most of them were in males between the ages of 12 to 39, but most of them, in fact, between the ages of about 12 and 20. So it affects mainly young or adolescent males, very rarely, and it's almost all of them have been mild. That's the one study. The other study, which is in Israel, where they've had a very extensive vaccine rollout, as we know, the world leaders in this respect. They've immunized 5 million people, picked up 275 cases. 95% of them were mild, spent not more than 4 days in hospital, and again, young males between 16 and 19 years of age. So the bottom line is myocarditis is a recognized side effect. It has been put onto the FDA sheet as a side effect which needs to be looked into, but it is extremely rare, and it is mostly mild. Almost all of them have been mild without any permanent side effects. Dr. Manzi, I'll leave it there because I realize we are a little bit short in time. Thank you.
Thank you very much. Thank you very much, Professor Shub. Much appreciated. Now, if we can just invite Ms. Melanie Wilmerens to come through, and just if you could just quickly take us through the interactive dashboard. And then thereafter, we would have invited the Honourable Deputy Minister to close, but the Honourable Deputy Minister has an event of which he will elaborate. And so he has actually requested that we ask him to come straight after Ms. Wilmerens, so that he can be able to actually be excused and travel to his destination. So Ms. Wilmerens, please take us through quickly the interactive dashboard, and then we'll invite the Deputy Minister to come through. Thank you very much.
Good morning, everybody. Good morning, ministers, Deputy Minister, DG and colleagues. I'm quickly going to take you through the new dashboard that we have released on the SA coronavirus website. Just a quick orientation. If you go to the SA coronavirus website, you will see that there is different tabs that you can click on. You will click on the vaccine update tab. You will have a drop down, and then there's a drop down. Under the drop down, you will select the latest vaccine statistics. And once you've done that,
my apologies, Ms. Wilmerens. I don't know if it's just me, but we cannot see the screen. We were just seeing a black screen. If you could maybe stop sharing and reshare.
Thank you. Apologies. So it's still not visible.
It's visible now. Thank you.
Thank you very much. Okay, so I'll quickly just start again. So you'll go to the SA coronavirus website, which with the URL, I think everybody knows it by now, SA coronavirus, one word, .co.za. At the top on the landing page, you will have different tabs. You would go to the tab that says vaccine updates. There will be a drop down. In the drop down, you would select latest vaccine statistics. And now, okay, just a little bit slow. And then the dashboard will generate onto that. I think it's just a little bit slow because of the internet. And then the dashboard, because everybody wanted to know how many vaccinations did you do today? And up to now, we reported 24 hours there was a delay in 24 hours, the dashboard now would report the actual vaccinations that's recorded on the EVDS as at 5 o'clock every day. And so the cutoff date for the daily vaccinations is now 5 o'clock. And then it will be, by the latest time that it will be updated live on the SA coronavirus website, is at 6:30 in the evening. So at 6:30 in the evening, the latest information will automatically be available on the SA coronavirus website. And you don't have to wait for any press release, but it will be available directly after the update. The intention is that we move, as we roll out the program, that we move towards having the dashboard updated on more regular during the day. And this is just our first initial publication, so that we can move towards a more regular update during the course of the day as the vaccination program is unfolding. So the first page is just giving the total vaccinations that has been administered in the 24 hours. We already received some questions to say, what does this mean? So what it basically means is this is vaccinations that has happened 1 minute past 5 on the 23rd of June until 5 o'clock on the 24th of June. And this afternoon, it will update, and it will give us information that's 1 minute after 5 on the 24th of June until 5 o'clock on the 25th of June. It just gives all this, includes all vaccinations that has happened since the start of, it's all the vaccinations that has happened yesterday. So it includes both J&J and Pfizer. So it's the total number of vaccinations that has been administered in the last 24 hours. So we're not distinguishing between the different programs and the different vaccinations. So this is everybody that received a jab in their arm yesterday per province. And then the next one next to it, just indication of the vaccinations that has happened in private facilities and vaccinations that has happened in public facilities. And these are total vaccinations for the day that has happened in the public facilities, and total vaccinations that has happened in private facilities. At the bottom, you'll see there's then a scroller where you can go from page to page. The next one is then giving a snapshot view of the total vaccinations thus far. So until 5 o'clock yesterday, the total vaccinations, so the total number of people that has received a vaccine in the country was 2.55 million 248, as announced by Minister earlier. And we all know the Sisonke program, and that was during the trial. You will see that the Sisonke program will also, the figures will change. We are working on capturing paper-based records of individuals that were vaccinated during the Sisonke program. And then for the national vaccination program that started on the 17th of May, the total vaccinations is here at the top. And then it is then also disaggregated by province. And then you can also, it will just highlight the national figures or highlight the Sisonke figures for each one of the provinces. This graph will give an indication of the vaccinations over time. So we will see that the pro-national program started on the 17th of June. And if you move, it will give you every day the cumulative figures of vaccinations day on day. So at the top, you will see that if I hover with my mouse over it, it will give me 2,070,478, which is the similar figure that we have at the top. And then similarly, we can also have the daily cumulative figures of vaccinations during the Sisonke trial. The next page is just giving a summary of the registrations. Similarly, it starts with, apologies, with the total number of registrations that has happened in the past 24 hours. And it's a similar principle of it's 1 minute past 5 on the 23rd of June until 5 o'clock on the 24th of June. And this only reflects self and assisted registration. Like for an example, with the Department of Basic Education, we're working from a beneficiary database, and we also have a similar or a different process for the occupational health stream. And this is just the total number of figures of individuals that has registered or that has been assisted to register for the general population. And as of yesterday, we had a total of 23,748, of which 126 were addition to the healthcare workers. And the last one is then giving us just an indication of the registrations. So we can see that the gray line is the registrations of the healthcare workers, and the green line is then when we started with the over 60 population, and that line has then incrementally grown over day, and it gives us the cumulative figures daily of the individuals that has been registered for the 60 plus population. You will notice that here we see some 60 plus registrations already from the beginning. So we include all 60 plus registrations within this graph. And then this just gives us a disaggregation between healthcare workers and the 60 pluses, as well as per province. And that's the start of a dashboard to give you more information. And we will continuously build on this as we move during the vaccination program. Thank you, Dr. Manzi.
Thank you very much, Ms. Wilmer-Rance. Let us invite the Honourable Deputy Minister of Health, Dr. Joe Phaahla.
Thank you very much. Thank you very much, Dr. Manzi. Let me pass my regards to colleagues, Minister Kubayi and Minister Mchunu, and also the panelists who have already given us a lot of very important information. I wish to join Minister Kubayi in acknowledging the good work partnership from the education sector. I think they've really led from the front and give a very good example. We want to thank Minister Mutseha and the team, and also all the MECs and also the unions, because part of the success of this program has been the support of the worker representatives. I think it lays a very good foundation, as already indicated by Dr. Crisp, that they are working very hard with the other frontline sectors, including the security, the police, the home affairs, correctional services, justice, and all those, including also in the private sector. We want to urge at this stage, the work is going on very well on the education sector. We want to call on all the educators and the support staff who qualify to make sure that indeed they are coming forward as scheduled. Because it's very important that this is properly organized. So far, except for a few areas where there were a bit of a problems, it's been very well organized. We are aware that there have been in some few areas some hitches, sometimes in terms of in the independent schools. There have been some hitches in some of the provinces, but all that we've been assured by the team that it is all being attended to. As already indicated by Dr. Crisp, that our capacity is really improving in terms of the supply pipeline of the vaccines, and working together with our colleagues in the provinces, we are therefore increasing the capacity to make sure that we can vaccinate more people very speedily as the vaccine supply is improving. And indeed, we are hoping that by the end of July, we would have surpassed that 200,000 and getting closer and closer as we go into August to reach the target which has been set by the president. We want to say that people should continue to register. As already indicated that from the 15th of July, we will be opening for the over 50s, 50 plus. But just again to emphasize that that does not mean that those who have not yet registered, those who are 60 plus, should not continue to register. They will continue to be encouraged to continue to register and come forward for vaccination. The system is improving the EVDS. We know that there's been some complaints in a number of times, long waiting times, a long queue, as indicated that the scheduling in some areas it's moving quicker depending on the number of people on the virtual queue. But we want to also encourage that where people have registered, and if it's taking weeks and weeks and you don't get a message, please approach your nearest vaccination site to try and seek an appointment, so that if they do have space in a number of areas, people have been accommodated in terms of almost a walk-in, but especially if you're already registered, if it takes too long, please feel free to approach your nearest vaccination site so that you can be assisted. We want to also just re-emphasize what Prof. Shoup has already mentioned, that as the vaccination program is ramped up, let us all remember that it doesn't mean that when you have been vaccinated, you should not use the non-pharmaceutical interventions. Even when you have been vaccinated, because you can still transmit the virus, we can also still get a mild infection. It is important to continue to use our masks and also all the other non-pharmaceutical interventions. Telegy, le babogedi ba ditaba ba ba mo ka leleme la Sepedi le Sesotho, re tšea sebaka se go leboga tšhomišano ya gagolo barutiši le bašomi ba tša thuto ba e leng gore ba šoma le rena gabotse matšatši a e sa le go bulelwa gore barutiši le bašomedi ba tša thuto ba tle ba hwetše meento. Re leboga ka mokgwa o e leng gore ba tlile ka bontši ebile ba etla ka lenaneo le leng gore le agilwe ke kgoro ya thuto re šomišana le kgoro ya rena ya maphelo. Re re barutiši le bašomi ba thuto le tšweleng pele go šetše matšatši a ka bago a seswai a gore le tle le hwetše meento ya lena go fihla ka letšatši la di-8 tša July. Le tla botswa ke ba kgoro ya lena, baetapele ba lena, gore lenaneo la lena la gore le tle le entwe le agilwe bjang. Re rata gore gape re gatelele taba gore mo mesong ya lehono Minister Kubayi o tsebisitše gore ba mengwaga e 50 go ya godimo le bona ba tla thoma go ngwadišwa ka mathomong a kgwedi e tlago ya July, go tloga ka di-1 tša July ba ngwadišwe. Re lebeletše gore go tloga ka di-15 tša July le bona ba hwetše meento. Re rata go gatelela gore ge go thoma ba mengwaga e 50 go ya godimo, ga go re gore ba 60 go ya godimo ga ba sa ngwadiša le go ka entwa le bona ba amogetšwe gore ba tšwele pele go ngwadiša. Sa mafelelo re re ge se ka lebala gore le ge lenaneo la meento le tšwela pele bjale ka ge re bona leuba la boraro, the third wave, le bona le gaketše, a re tšweleng pele go thibela ka go šomiša dipipa melomo tšela, go hlapa matsogo le di-sanitizer, le gore se ka tsena go agolo mo gona go le mašabašaba. Ke a leboga. Thank you very much.
We're now coming to the question and answer session now. Colleagues, it's almost 9 o'clock. We have really now gone over time. There are quite a number of questions, and with the permission of the Minister, if I may propose that the questions that are on the platform itself maybe can be dealt with by the panelists, and they can respond to those questions, and they can respond to both the questioner and the panelists so that we can all have sight of those answers. And then we concentrate on the questions that have come through from members of the media. I'm also going to request members of the media that quite a number of questions came through during the presentations, and a lot of the questions have been covered actually by the presentation. So I'm going to start from the back where some of those questions came in a little bit later, which have not been covered by the presentations, and then we'll move backwards. And if you can just forgive us where we've covered, if you'll allow us to say, well, that area has been covered. The recording will be made available, and the minister's address has actually already been posted. So let us begin then. With the minister's, if we can go, if we can do it like that. Now, Burger Netwerk 24 is asking, is it possible that Gauteng only will be placed under a different lockdown level with additional restrictions than the rest of the country, or will additional measures and restrictions apply to the entire country? Sophie Mukwena from SABC to the Acting Minister of Health. She has 3 questions. Her first question is, many countries have reported a surge in numbers of COVID-19 cases that are when is South Africa going to receive the vaccine consignment from Covert? Third question, Strive Masiwa, who is assisting Africa CDC to buy vaccines for Africa, has criticized Covert, saying it has contributed to challenges of access to vaccines. What is your reaction? Then we have Vickers Berger again, asking, has the NCCC met yet to discuss moving the country to another lockdown level with additional restrictions, and have recommendations been made to Cabinet yet? And can we expect an announcement on additional restrictions? Riante Pariachi from ETV News. Are people, 3 questions also, are people who are awaiting a second Pfizer jab expected to wait for an SMS with a date, time allocation, or will walk-ins be allowed once the 42-day period is up? The second question is, has the department looked into why Gauteng's COVID numbers are so exorbitantly high compared to other parts of the country? And the third question is the department considering if journalists will be considered essential workers and will be eligible to get vaccinated anytime soon? I think, Minister, let me stop there with that set of questions, and then we can move on after that. Thank you, Minister.
Thank you very much, Lwazi. I think let me start with the issues around whether we're going to move to other levels in terms of Gauteng. We will present the report to NCCC on Tuesday in terms of what we've been able to observe, based as well on in terms of the discussions with everyone that we have engaged with, verification, and a decision will be taken by NCCC on what to be done. There's been lessons out of the previous sessions that we have, or previous waves, so we'll take it from there. I think I don't want to actually almost say what is going to happen out of that. We've listened to the Premier as well, where the issues around what they would want to see in terms of Gauteng and what they don't want to see. So we'll address next week after the NCCC in terms of what has been the decision. There's been a question about, I think I'll start here. The issue here around Gauteng, there's continuous work that is being done by NICD to understand the pandemic in the province. Yes, in terms of the analysis and the numbers that we are seeing, more and more numbers, or we're seeing an increased number in terms of the 19-year-olds in that category, young people. And I think sometimes it leads to the speculation that whether Delta Plus is already in the country, and we are seeing that. There's not been evidence of that, but sequencing continues. Should there be enough evidence that says otherwise, we'll be able to pronounce and be able to do. For now, we know that what continues to be in our midst is the beta variant. We've not seen the Delta Plus in terms of Gauteng specifically, but we are trying to understand the numbers. We've asked as well questions when we met with Gauteng, for example, whether they are seeing any trend in terms of behavior, in terms of what we are seeing in the numbers. Quite a number of issues that they gave us feedback, which we are hoping in the coming 2 days or 3, we'll be able to support that with our work that is being done by the clinicians and the epidemiologists in terms of the work that is being done as well from NICD, supported by that, is whether, because one of the things they're raising, for example, is that you are seeing more and more simple things in families where somebody has passed away in the townships. You are seeing people still visiting the families in terms of passing condolences. That's a so passing duduzo. Those things are causing a problem, because when you go and you start having one person that is visiting in those families, it causes social gatherings. People think that if we are 10, we are 20, it's not going to. For example, if you look at your people by Mamelodi, Atteridgeville, Harangua, all those, the social are a problem, because if 10 of you are gathering and then you leave and go into 10 families, then it's spreading. They have raised with us the issue of family gatherings, which are a bit of a problem as well. So we're looking at those data specifically. So just to answer specifically, we do not have clear scientific evidence that says there's a new variant. When we interacted with the team that is working, has told us that there isn't a variant. It could be a variant, it could be behavioral issue. So the issue of gatherings, and I want to go again in terms of what we are seeing, for example, in Gauteng continued, and this I raised with the MEC to request that the provincial leadership also look at the permits that they're giving for gatherings. We have marches that are continuously happening in the province, which is serious concern for us. I mean, if you have people are gathering continuously, march after march, I'm not so sure, even the issue around consequences. Because if the law does not permit for people to gather who are more than 100 outdoors, and somebody leads a gathering of more than 100, surely an example should be made. That person must be arrested. And that will send a strong message around compliance. And that's what we are appealing to law enforcement, and we'll take this message again as we go into our NCCC, because we think that it will go a long way in assisting. Let me just say that the teams are raising concern to say even the 50 is too much, the 100 is too much in a surge in Gauteng. For example, where you are finding if you have to trace 100 people, let's say, out of that 100, 20 people are infected, you times that with 10, you times that with, it just becomes a huge number. So that's why it's important to say when these numbers of the gatherings, because we really, really worried about these gatherings, the permission that are given in terms of the marches, in terms of the gatherings. The previous day, there was a gathering outside a court. It's worrying to see such happening. It's irresponsible of individuals who are leading these gatherings. It's irresponsible of individuals who are attending these gatherings. So we really, really have to see the upping of the law enforcement agencies, but South Africans as well, and leaders taking a responsibility to say we are not going to compromise our followers. And that's why I need to be strong in this area, because we really appeal, please bear with our healthcare workers. They are really under pressure. Stop being irresponsible. And that's the message I'm saying as the acting Minister of Health. The other issue that Sophie raised is around what Strive Masiwa has raised. Masiwa has raised. Strive is an envoy of the President Ramaphosa. The principles that he's raising around equity of vaccine, availability of vaccines are what we associate ourselves with, and what President has been clearly saying publicly, to say it shouldn't be that we find access to vaccine being a difficult or a scarce commodity for the countries which are developing and the poor countries. And those in terms of the issues, we associate ourselves. And I think the theme and what we are highlighted, we remain committed to operating within Covert's system and Covert's facility, but we do believe that there are a lot of issues that needs to be addressed for all of us to have access to vaccine, especially for the continent. He's been doing a great work in terms of mobilizing the resources. He knows the difficulties. I've interacted with him several times in terms of what needs to be done in supporting us as well as a country in his work as an envoy of the continent. So the work that is being done, South Africa does not isolate itself from the entire continent. We do believe that is important for us to continue operating in a collective, while we also ensuring that we do, as a country, sovereign country, going to source the vaccines ourselves so that we can be able to protect our nation. So that's important. And I think another question was around when is the NCCC meeting? It's meeting next week, Tuesday. As I said, we'll give the report. So yeah, there's that. But mainly what is important was that I need to highlight to our citizens and also to the media. The first issue for me is that we need to remember why we're moving in terms of phases in vaccinating the nation. If we have the supply, and I'm linking to this discussion about what Strive has been saying and what the president has been saying, if we had availability of the vaccine, we would want to vaccinate everybody immediately. But we're working based on the schedule, as you hear. We have what needs to come now in the next quarter in July. And that's why we work on the phases, because you need to vaccinate as we receive. So the supply side remains a challenge. As we have the supply, if we have the supply in abundance and we are able to get it, and then we can vaccinate everybody. But in terms of the schedule of supply, that's how we are phasing out in terms of making sure that we vaccinate the population. So that's why we'll move with the 50 plus. It's almost around 4 million population we're adding to the senior citizens 60 plus. Then we move into the next level in terms of availability based on the schedule. So once we finish, we are hoping if we move swiftly and the vaccine supply available, I think we should be able to say within the IMC will consider whether in August we start with the 40 plus. We want to ensure our interest as government is to ensure that we vaccinate as many people as possible. We want to ensure that we protect even the front line. We want to make sure that we protect even the workers. I know there's been an issue around journalists as well. And as we've prioritized and we finalized this work, we've committed to the IMC that next week we'll go and detail a plan in terms of parallel, as Dr. Crisp has said, that we want to make sure that all the sectors are covered, and will be guided by both the MEC and the IMC to say, okay, this is the next phase that we are moving as we go in terms of those categories. I think I've been able to answer those. The last thing I think as well that I want to say, Lwazi, just before even I conclude, we've been able to articulate what we are doing in terms of how to ensure, and the reports that we are receiving on what phase is which vaccine application is. We want to appeal, can we not target the regulator? The systems that we've put in place as a country in terms of regulatory independence needs to remain so that we don't lose our credibility as a state. So politics aside, let's not use politics to influence regulators. Let's ensure that we work on the basis of information that is available. Applications must go in with the required information. It's not the regulator that does evaluation and collect data and runs trials. The applicants needs to make sure that they submit the information as required by WHO to us as a country through the regulator, so that we protect the citizens. I don't think any of us would want to be given a vaccine or a medicine of any sort that has not been tested in terms of its efficacy, its terms of its side effects. That's why we continuously communicate information that relates to the dangers if there are concerns about vaccine, so that there's transparency. So that process is very important. It protects all of us, but it protects even the integrity of our systems. So the marches are not helping us in terms of putting pressure on regulators. It's not going to assist us. Let's make sure that what is required, what has been working, we provide the necessary applications that are needed with data that is needed for applications to be considered. And if approved, we can be able to use them effectively to the best interest of our nation. Thanks, Lwazi.
Thank you very much, Minister. Before we move on, Minister, I believe Minister Mchunu has requested that he be excused. There were no questions for Minister Mchunu, so through Minister, perhaps we can allow him to be excused.
Yes, Lwazi, thank you very much, Minister Mchunu, for supporting us and joining us.
Thank you, Minister. I think he's logged off. Thank you so much. We can then move on. We have a question
country as we battle the third wave of the COVID